especially as I'm not trying to be gender biased, but I'm sure that being a leader, a woman who is a leader in healthcare, you are meant to be a nurturer. You're meant to be as a woman, you're actually meant to be a nurturer, right? And the theme of this podcast is when patients meet patients, right? So how would you say this has played for you in the course of your leadership roles in healthcare?
Okay, so it's interesting you ask this because I mean, a lot of the health workers are women, but you see, as you rise
Mm,
to the ranks, you see fewer and fewer women. Yeah, so it's almost like there's a
mm,
broken pipeline. And some of the challenges I have faced, I think they include that work-life integration. How do you balance family issues with work? I remember as
yeah.
a house officer, I mean, my schedule was so busy and so tight, and I just had my first child. Then I had to leave him with my mom. I don't know if you're familiar with Lagos. I mean, it's like coming from the hospital. By one day off, I'd come from the hospital, get to the junction, and wonder whether I should go and see my child, who was with my mom at the time, or go and see my husband, who was at the other end of Lagos, or just go back and lie down and rest. So there were those there were those
Yeah.
times that were tough, but it didn't last anyway. I mean,
Mm,
another challenge I had was being a female in charge of, military men in the
mm,
barracks clinic. I mean, that was tough. First of all, you're a woman, and then again, there's soldiers, you're a civilian.
mhm,
Yes, telling them what to do, and almost as if. But then your technical skills, your leadership skills would always help you find a way to connect with them, to also bring them together and get things done. During my time in the barracks, I remember we were able to implement the rollback malaria project. Yes, find out about how people were affected by malaria and, implement some things to help them to curb that. And then also, I remember there was this case where this woman ran in with a convulsing child. She just dropped the child on top of me and ran back. And
my
later, when I
God.
asked, they said, okay, her husband was not around. Maybe she just quickly ran. She saw the child was dying and dropped him and left.
Mm,
So we had to stabilize that child. And when the husband came later, sat down with him, talked with him. And that was how, together with the other soldiers, we started doing that health education, engaging with the heads of the different barracks units to make sure that such things didn't happen again. And it was really great for me because I think where I really got validation was when somebody from the teaching hospital nearby, the military reference hospital, came and said, we're not seeing those cases anymore from the barracks, all those malaria fever and things, system in place, and we're dealing with that. So yeah, challenges, but
wow.
we can surmount them.